I feel that when people are told that you have from the blood test prediabetes, it's a beautiful opportunity to know early that you can make a change, right? So instead of being told, your diagnosis diabetes already based on the criteria and what your blood test shows. If you're at the prediabetes, that's when you can make the change. That's when you can actually really prevent from having, some of the damage that occurs quite early on when you have diabetes. So making sure you get the exercise. It's amazing how much you can actually bring your blood sugars down by doing regular exercise, walk after a meal, and obviously changing your lifestyle habits and your diet, and making sure that you get out of that prediabetes zone. But that is like a beautiful opportunity to know that information early so that you can make a change.
Are there other lifestyle changes you would recommend for managing diabetes?
So the important is the diet and the exercise, obviously most important. And I do think it's important to just be knowledgeable about what is the healthy diabetic diet. Sometimes I think we don't get all that information properly. So I usually do refer people to the sources, and I make sure that they go to a diabetic clinic, because it's very important to see the dietitian and speak to the experts about how do I manage my diet moving forward, and that's proper for me. So I still do believe that the most important thing is making sure that you do have a proper exercise routine that you're able to do and that is regular, and that you have a good diet. And that you're speaking to the right experts.
I did hear from a kinesiologist recently that you can actually do the exercise in your chair, and it's just as effective, especially if you're unable to walk. Or I know diabetes, there's a lot of amputations that happen and those kind of things. So that was a very interesting comment for me to learn.
Yes, that's actually a very good point you brought up, because most people always associate, I can't go for a walk because I have this issue or that issue, but you can do so much even in your bed, right? So we have patients on dialysis lying down because they can't really sit up because they have issues with this or that, and they exercise with one of those little bikes in the bed. So there's lots of things you can do sitting in a chair. But as you know, as you're providing some of these information for patients, it's important to link into those things and see, okay, what can I do? What kind of small exercises can I do? Even a small little weightlifting that you can do with little ankle weights while you're sitting. But yeah, incorporating that into your lifestyle early on and keeping that up. Even for patients on dialysis, they do much better when they don't have that muscle loss, the sarcopenia that we refer to. They do way better. They have way better outcomes if there's incorporated exercise, resistance exercise, into their lifestyle. So it's very much encouraged, and it helps your mental health, as we mentioned.
Absolutely. Is there anything else that we haven't asked you would like to share?
I think that, having been in kidney care for a long time, I do feel that it's very encouraging, and it makes me very happy to see that there's so much new opportunities for patients to be able to get education early on, change their projection of their kidney disease, and steer it themselves, right? And having that control more, and so many more things available that can help to reduce the progression. And then, being hopeful that it's not the end of the world if the kidney function there's so many new options as well at that point, where you can still travel and do dialysis, and you can have options for transplantation, and dialysis can have all these different ways that you can do it. And as long as you're able to be open to those options, your life can still be very fulfilled, and you can do all those things that you like to be able to do. Because a lot of times I think I've heard in the past that people feel that, okay, well, if I start dialysis, then my life is over. I can't travel anymore. That's not true. All those things are available. All those things are possibilities. And we want to be able to work with our patients to make sure that they are using all those opportunities. So I do feel very much more positive that we're able to offer all these different opportunities now to our patients.